I am Karen Marshall and I am a nurse consultant from the RVI Hospital in Newcastle. COPD is two conditions. First one, chronic bronchitis, is inflammation of the tubes where air goes in your lungs. Emphysema is actually damage to the lung tissue itself. Generally the symptoms start off with cough, shortness of breath. You may or may not bring up phlegm. They are the main symptoms of COPD. Smoke goes down into the lungs and damages the tubes and the actual lung tissue. For my patients, generally 99% develop COPD because they smoke. COPD has a massive impact on quality of life. Patients, because they're breathless, start to do less. When they do less, they get more deconditioned and unfit, so they're not able to do the things that they want to do, and eventually some patients just actually can't get out. They can't do the things they want to do and often get feelings of anxiety and depression. Flare-ups are just worsening of your COPD, so it's bad enough to start with that you will get breathless when you do things, but when you get a flare-up it's 10 times worse. You may or may not get a chest infection, so you get increased breathlessness and can't do the things you want to do and feel very unwell. A lot of patients say that actually they feel like they're suffocating, they can't breathe at all, they can't get any air in, and that makes them feel really panicky and anxious. The best thing to prevent getting COPD is not to smoke in the first place. If you do smoke, the next best thing is to stop. That is the only thing that's actually going to stop the COPD getting worse and actually help your breathing. It is never too late to stop. Even if you've got really severe lung damage, stopping smoking will help you live longer. People can get COPD from as young as 35 onwards. If you've smoked a lot from a very early age, you can develop COPD really early on. One of the warning signs that you may be developing COPD is having a cough, feeling short of breath. It's best to really think about stop smoking straight away and go to your GP so you can have some breathing tests to see if you are developing COPD.